artery. Pulmonary artery normally present in the right ventricle and aorta in left ventricle, but here is vice versa. The aorta in right ventricle and pulmonary artery in left ventricle. Okay, this is the thing which are we going to discuss. The transposition of great arteries is ventriculo-arterial discordance, in which the aorta arises from the morphologic right ventricle and the pulmonary artery arises from the morphologic left ventricle, like this. Then incidence, the overall annual incidence is 20 to 30%, 100,000 live births. Then etiology for transposition of great arteries is unknown and is presumed to be multifactorial. The congenital heart defect is more common in infant of diabetic mothers, specifically when the mother is on the insulin at the time of pregnancy. Then the pathophysiology, what happened? Normally, pulmonary artery take blood, receive deoxygenated blood from right ventricle and give into the lungs. After that, you know the exact what is the cycle. No, okay. Then the aorta take the oxygenated blood and give into the system, all the system. But here, the aorta present in the right ventricle, aorta receive the deoxygenated blood and give into the systemic circulation, give into the whole body, and pulmonary artery receive the oxygenated blood from the left ventricle and give it into the again for purification to lungs. And in the system, in the body, the blood circulate. Which blood circulate? Deoxygenated blood circulates. That's why the kid suffering from transposition of great artery always looks like cyanosis. Okay. The pulmonary and systemic circulation function in parallel rather than in series. Causes transposition of great arteries. Oxygenated pulmonary venous blood returns to the left atrium and left ventricle, and from where the pulmonary artery take the blood and give into again to the lungs for purification. Recirculated to the pulmonary vascular bed via the abnormal pulmonary arterial connection to the left ventricle. Okay. Then deoxygenated blood, systemic venous blood returns to the right atrium and right ventricle give that deoxygenated blood to the aorta, and aorta again circulate in the whole body. Pump to the systemic circulation effectively bypassing the lungs. Deficient oxygen supply to the tissues and an excessive right and left ventricle workload. It is incompatible with prolonged survival unless mixing of oxygenated blood and deoxygenated blood occur at some anatomic level, like if the condition is transposition of great arteries. And if there are atrial septal defect, ventricular septal defect and patent ductus arteriosus are there, then some chances are happen to mix the blood and gives a few amount of oxygen to the system. Okay, otherwise the life is in danger. Then clinical manifestations, prominent and progressive cyanosis within the first 24 hours of life is the usual finding of infants. Then tachypnea is there, difficulty in breathing, tachycardia, fast heart rate, diaphoresis, and failure to gain weight. Then heart sound is single or narrowed supplant, diminished second heart sound, systolic ejection murmur may be present, abnormal sound you can heard with the help of stethoscope. Diagnostic evaluation, we collect the history, physical examination from where we know the cyanosis, ABG analysis, what ABG clear to us. ABG, when we take the ABG analysis, that time it provides the information regarding how much oxygen given to the blood by the lungs and how much carbon dioxide taken by the lungs from the blood. Okay, and the imbalance between oxygen, carbon dioxide and pH value we have to know with the help of ABG analysis. Then echocardiography and cardiac catheterization. Next is chest radiography. What happened? Demonstrate the classic when in the X-ray the on the place of the heart it looks like egg shaped heart looks in the X-ray in chest radiography. Then medical management. Initial treatment consists of maintaining ductal patency with continuous intravenous prostaglandin E infusion to promote pulmonary blood flow. Then antibiotic prophylactic regimes for endocarditis, fluid replacement, bicarbonate administration, acidosis and mechanical ventilation. Then surgical management, Rastelli type procedure, ligate the main pulmonary artery and place an aorta pulmonary shunt during the newborn period to restrict pulmonary blood flow, and arterial switch procedure. Here, like here, the placement of the pulmonary artery with the help of surgery done in the right ventricle on the exact place and aorta on the left ventricle. Then arterial switch procedure, it is clear here. On the right ventricle there is aorta, but with the help of surgery the aorta provide the blood to the lungs and arteries give blood to the systemic circulation. Okay, then complications, congestive heart failure might be there, arrhythmia, Eisenberg syndrome. There is a irreversible supply of the blood, irreversible and progressive pulmonary vascular obstructive disease. Then prognosis, the overall survival rate following arterial switch operation is 90%. The overall mortality rate following an arterial level switch is low. However, long-term morbidity associated with systemic and ventricular dilatation and failures. Then I hope you have clear with this. If you feel any kind of problem, kindly inform me. I feel very happy to help you. Thank you very much.